The coronavirus crisis has exposed gaping holes in America's healthcare system.
Why haven't you been tested?
I don't have health insurance and I can't afford a doctor.
Some 28 million Americans have none at all.
And it's brought new urgency to the debate around universal healthcare.
Is the coronavirus the best case for Medicare for all?
The call for reform has come mostly from the left.
We are the only major country on earth not to guarantee health care to all people.
Though one poll found that about 2 in 5 Americans, including a quarter of Republicans, say the pandemic has made them more likely to support universal coverage. But this debate has played out again and again over the past 100 years. And that long experience sheds light on the way forward as COVID-19 puts America's medical system under strain. I'm Jessica Mendoza with the Christian Science Monitor. And in this series, we look at how history can help us understand major issues we face today. This week, universal healthcare. When we look back at America's efforts at healthcare reform, we see that there's a pattern.
What we can trace to the present is that wave of enthusiasm.
This card will give comprehensive coverage.
And then a very strong wave of opposition. And the opposition has, to this point, essentially always won.
We will never let socialism destroy American healthcare.
This kind of back and forth is important in any democracy, but times of crisis, like what we're experiencing now, can drive major change. And the Roosevelt-Truman era shows us how.
Roosevelt himself was moved from hesitancy about health reform to promising it, essentially, to American people. We sacrifice our men, we have our industry mobilized. Why should you do that? Because when the war is over, you will have health benefits.
We should widen the opportunity for adequate medical care.
That was the great promise held out, and that provided energy for Truman's initial burst of reform enthusiasm.
This great nation cannot afford to allow its citizens to suffer needlessly from the lack of proper medical care.
Truman's National Health Insurance Plan aimed to lower costs for patients and address gaps in access to care by asking the public to pay a tax or fee. But, as expected, Truman faced powerful opposition.
We insist that the practice of medicine is a doctor's problem. It must never become a business or a trade, never the subservient tool of a governmental bureaucracy.
Truman's critics, including the American Medical Association, insurance companies, and conservative politicians, called his plan socialist.
That had a lot of credibility and legitimacy. The late 1940s was the period of the so-called Red Scare.
Universal health care failed during Truman's term, but his ideas didn't go away, and they eventually paved the way for significant reform. In 1965, Lyndon Johnson signed Medicare into law, with Truman by his side.
The idea was if we can get a program through just for the elderly, that'll be the stepping stone. And that is how we're going to create universal health care, is by expanding Medicare.
The bill, which passed in the Senate with bipartisan support, covers people over 65 and those with disabilities. It's still one of the most popular social programs in the U.S. today.
We marvel not simply at the passage of this bill, but what we marvel at is that it took so many years to pass it.
Our history with healthcare reform shows that even as change slowly comes to our social systems, the battle lines stay remarkably consistent. And as we confront the challenges of the coronavirus crisis, it may be helpful to remember that who we are as a society shapes the path we take.
Americans among advanced nations have a deeper strain of libertarianism.
Get off my back, get out of my pocket, and let me have more control of my own destiny.
So lots of people look at universal coverage and they say, that's not what this country's about, that's not my value.
But the times we live in matter too.
A crisis usually emboldens everybody to argue harder for whatever they were arguing for before. But the hopeful side is that people will see that they have a stake in each other's well-being.
Everything we know about this
particular virus is something that will be with us in our communities, in our country, in waves for some time to come. It will shape the way in which we deliver and organize and provide healthcare for months, even years to come.
Thanks for joining us. If you like this video, please hit thumbs up or the share button. And for more of our coverage of this pandemic, go to csmonitor.com/coronavirus.